those who don't know me, I'm Councillor Lucia Das-Neves, and I'm the Cabinet Member for Health, Social Care and Wellbeing, and the Chair of the Health and Wellbeing Board. Thank you all for joining us online and for those in person. Just draw your attention to item 1 on the agenda, the film being at meetings protocol as per usual. And what I suggest we do is, we've got Councillor Carter. What I suggest we do is don't do a round of introductions, but if you could all make sure that you do introduce yourselves when you speak for the first time, that would be really helpful. Now, apologies.
Yeah, I've only received apologies from Anne Graham and Nadine Jill.
And we don't have any items of business. Have any declarations of interest anyone they need to make? No. Thank you. And I don't think we have any questions, petitions or petitions.
No.
So straight on to item 7, the minutes of the last meeting. Are there any comments, observations, or corrections needed? Karen?
Yeah, can I refer to item 21, the discussion about physician associates meeting, and the suggestion that guidance would be being developed patient as their rights if they meet with a physician associate. Can we know whether there's been any development? There is a lot of concern amongst patients to what's happening on this front. I know, but made clear to patients.
Yeah, understood, Sharon, and that's definitely something that's come up every time I've talked to colleagues about PAs. Is very, very, very important to know, being regardless of who the professional is. Actually, that's something I think we agreed. Will, do you have an update on?
So Claire Henderson has circulated an update on the questions that were raised at the Health and Wellbeing Board. So we'll circulate them after the meeting.
Thank you.
If that point hasn't been picked up, we'll pick up again.
Well, let's pick that up outside of the meeting. We'll just have a little conversation about being provided to residents at the moment and how that should be improved.
Patients would like to see a timeline on this as to when some guidance is
understood. I guess some of that might well be dependent on much bigger forces than Haringey itself. Let's pick up and.
So just looking at the response, so there are, as was discussed in the last Health and Wellbeing Board, there is some national guidance coming out, and kind of the plan from the ICB is to wait that. But I hear what you're saying around we need probably something in the review so we can take that outside the meeting. But yeah, there will be. The GMC would be introducing regulation for associates from 2026, and there's an independent review ongoing. Yes, this was the other point that was raised in the interim.
Thanks. We'll pick that up then. Next to that action as well, so get lost. Thank you. Anything else on the previous minutes? Okay, well, in that case, I'll take them as accepted, and thank you very much. Let's move straight into item 8. Tim, to give us an update on the change programme and a little bit on work.
Certainly. Thanks, and Tim Miller, Assistant Director for Place at the Integrated Care Board, and me. So firstly, just a verbal update on where we are with the changes to the Integrated Care Board at the moment to keep the board aware of progress. Central London, and along with the other CBs in London, submitted their initial proposals and also to NHS England, and there was then a moderation process and following those discussions, there is a developing proposal expected to go to the boards of North West London and North Central London integrated care boards in July, proposing a merger between the two ICBs. They were already in discussions about ways of working together to find efficiencies and collaborate. And those conversations were already ongoing, but as they continue to look at what we can deliver within the financial envelope, in order to make organisations that are, an organisation should a merger happen that has the capacity and the financial resilience and the capability to continue the purpose of improving population health. There's a proposal expected to recommend merging. It is subject to the board's decisions, and those boards haven't happened yet. So it's just a update on the sort of direction we are expecting at the moment. Should that be approved, then sort of the organisation design process and restructuring that will follow after that. So still working to the national timeline of completing the reorganisations during this year to within the funding available and set nationally.
Thanks, Tim. Okay, yeah?
Yeah.
Well, thank you. While everyone's thinking about what questions they have, I might just jump in, and I suppose it would be useful to know a little bit more about that governance process of that decision, or at least, when we might know a little bit more about that if we don't know anything more now. Obviously, this will be of concern, as everything is. And also, I think I forgot to acknowledge right at the beginning, this is a really tricky time for all health colleagues, I know, and the uncertainty is out in many ways, but invariably worries our residents as well. So I think it would be really useful to understand that governance and to understand within that also how we'll establish the implications, how we'll assess the impact of that merger on residents. And after all, I'm the chair of the Haringey Health and Wellbeing Board, so to know about the impact on Haringey residents. I don't think I'm in danger of being parochial in that. But and in particular, I'm interested in the impact on equity and on health inequalities, which are, let's be honest, a huge concern for this board, a huge concern for all of us in the borough. So I guess it would be really interesting to understand where and when and how those things will be discussed.
So Frances Callahan, as the Chief Exec of North Central London, has been absolutely clear in her continued focus on patient health and on inequalities, on borough-based working and on delivering neighbourhoods, which is one of the organisation's strategic priorities at the moment. Plan. So the commitment to those things is unwavering, I would say. In terms of governance and process, there will be, I believe, an options appraisal or an evaluation that will go to recommendation through the ICB board meetings in July. I can't remember the dates. One I think is the 17th, and the day apart, the 17th. Those boards are meetings in public and papers will be published in advance. So see those when they are. And obviously we are working at speed and far faster normally undertake this sort of process. So I would expect those papers and the report to board will absolutely be addressing some questions you've raised, but until we see those, we'll those two. And then it's a decision, I believe, for the two boards to make, which would then be either endorsed by NHS England.
Okay, interesting. I'm sure others in the room will ask it, and I'll ask it too. There isn't much space in that level of pace doesn't sound like, and it certainly isn't, we're not accommodating a wider engagement. No doubt I can have a conversation with the leader of Haringey Council who sits on the ICB, but others in other boroughs might feel more difficult for them, although she's there to represent all local authorities and will, I know that, no doubt. But there is something about patient voice and also about the voices of the organisations who are key for us if we think about a neighbourhood approach. So I guess I wanted to, I'm not going to grill you on that because I think your job's hard enough as it is, and I don't think you're really, I know you're not able to answer that. I think it's important to note and minute that concern that actually the voice of residents, and it doesn't feel to me like there's much space for a thorough engagement with the local authority, who I think are at the heart of neighbourhoods, but particularly the resident and community organisation voice. I don't know if anyone else wants to talk about that. Will and Sarah might want to come in a little bit.
Just to say thank you very much, Tim, for the update, and echoing what Councillor Dasnev said about the challenges faced by you and the fellow colleagues in ICBs here and across London. I think we, in an ideal world, this would be a kind of locally determined process with engagement, but I don't think it's the one of our local ICB not being able to do that. I think the decisions probably being made at a higher level around what's the optimum size and scale and things like that. But for the record, from my perspective, I think we really value having the ICB as structured as it is now, the local relationships, and there will be disruption as well as potential opportunities for the change. So just to note that definitely from my perspective, there are strengths in the current model that we have, particularly as we're developing neighbours. Thanks.
Thanks, Will. Absolutely. Sarah.
Thanks, Tim, and share and echo the sentiments said. There are a couple of areas where the proposed model going forward, there are still some areas where conversations are happening, and I suppose I specifically point to continuing healthcare, SEND and safeguarding, and really welcome the fact that the ICB is involving local authority and other partners in conversation, listening exercises and conversations around those three areas. But do wonder if there is any more you could say about those areas, which I think are areas where actually a partnership and a different approach, there could be an opportunity within, but that there are also some significant areas of risk, notwithstanding the wider piece and the change in role to the ICB as strategic commissioners in that space. So it would be just helpful to touch on what you know around those areas and sort of when decisions on what the next steps in relation to those three issues are.
Those of you who might have seen the Model ICB paper, there's a number of areas of ICB functions at the moment that were identified as potentially being transferred out of ICB in the future in the new structure, including the ones Sarah's mentioned. There are discussions going on, I understand, with the councils around those and between the two ICBs who are in discussion. I think, as with the other functions at this stage, there isn't, as I understand it, conclusions about the preferred model for those. And I think it's important that we just let the process kind of follow through at the moment of establishing whether the merger is supported by the boards. And then the appointments initially we expected for chief executive and then their executive management team, so they can then get into the organisational design more clearly, trying not to speculate or ruminate at this stage about potentially where things would sit. Those negotiations are still ongoing.
Thanks, Tim. There is a lot of uncertainty, isn't there, and a lot that's nebulous. A lot of you will know that I feel like it's really important at this moment. We are, especially when we, despite all the challenges, neighbourhood working feels like it has many answers to many of the things we've been talking about here. Certainly the 4 years I've been chairing this board. And so it's really important to collaborate together, work together, and to accept the shared system challenges we have, because we have a lot of challenges that are a collective issue. But I do want to, I suppose, lay a marker that one of the things that's burdened me over the last couple of weeks was the release of some FOI data on how much different ICBs were spending on different kinds of areas, including CHC, and it does burden me greatly to see those differentials and to think about what that might mean as impact for residents. And so when I talk about equity and inequalities, I'm thinking about some of those things. I'm not asking you to answer that, Tim, because I know that would be unfair. But I do think as we go forward, we want to be collaborative, we want to work together, but we also have to talk open and truthfully. That's part of having an open and honest relationship. So I can't very well sit here and not say that really worries me to see really big differentials that are not reflected in the population numbers or necessarily the challenges that our populations have, because I think they have real implications, equity, and hopefully everyone understands what I'm getting at. So I just feel like I want to lay that down and note that. Tim, you had your hand up next.
Yeah, thanks. It just relates to an earlier point that was made. So it is an observation. I haven't got a solution, and I recognise the pace of change that's going on. I mean, we're trying to keep up with it at the Federation and our members, but it struck me last week at the PPG meeting, and Dan might want to comment on this. So I think when people ask me about the NHS and the structure of the NHS, and you're a member of the public, it's quite difficult to explain it and how it all works. So at the PPG meeting, it struck me that it's even more complicated now, and how our PPG can understand what's going on and the impact on them and on their practices, on the neighbourhoods. I just think it's a really difficult thing to get across to patients and the wider community. So, I mean, it's just an observation. I think this is probably the sort of thing we got to probably work on quite quickly, really, about engaging our community and our patients within all these changes. So it's an observation.
Thanks, Tim. And Tim, do you want to just introduce yourself so we have that on record? And
yeah, so I'm Tim Fox. I'm the Chief Executive of Haringey GP Federation.
Thanks, Tim. I agree, and actually about 2.5 months ago now, maybe more, maybe less, I was at a meeting with my equivalents from across the country, and that very same point was made. I think it was made by me and supported by many others. Actually, as confusing and stressful, let's be honest, it is for colleagues here. It's also very confusing when you have to go out and explain. And you're right, I was in that meeting with you, and how to begin and where to begin was really difficult. I think Sharon was there too, but also, and I think I made that point at this meeting I was at 2.5 months ago. It sets hairs running, it stresses people, it raises concerns, like quite a few things, unfortunately, that are going on in the ether. It contributes to some of the wellbeing issues we know people are already facing, for colleagues here and for our residents, etc. So quite agree, Tim. Thanks for making that point. Lynette.
Thank you, Lynette Charles, CEO of Minding Haringey, Blackfriars Haringey Lead. I think I'm just echoing the concerns of Tim and yourself, and that is that anything like this that we hear about, by the grapevine or officially, really does start to concern people. I think whenever we hear about restructure, people assume that means that there'll be cuts, that there won't be services that they generally go to. And when I think even of us talking to our clients about the merger between the two trusts, it gets very confusing for people because names and logos and things are changed. So sometimes they just get concerned whether their services and support will still be there. So just really to note it that, yeah, that this is concerning, although I appreciate why these kind of conversations need to happen because of resources, but people are also aware when there's restructure, it often means cuts. So yeah, just echoing the concerns already raised in the meeting.
Thanks, Lynette. That's right. And actually, I suppose the one point I didn't make, which was that what we wanted was some 2.5 months ago, a bit more, some clearer messaging and a little bit of kind of support on that, and that hasn't quite come up. So Cody will write a message for me to chase up on that. And I actually think there was a plan to have another further meeting with my political equivalents across London to talk about some of those issues. So I think that will be useful. So I can, Cody can keep me in line and make sure I do that. Sharon, you want to come in?
Yeah, this prospect has been laid on us relatively recently before we've had a chance, as Lynette has said, to talk to patients and patient groups about it. Some of the people say, well, I've only just got used to more recent changes, and then having to cope with yet another one. But I mean, a number of questions which, from the Health Watch point of view, we have to ask. And first of all, why a merger with North West London? What about North East London? Might that be more appropriate for us? How, you raise the question of the governance of this decision. Why hasn't a different kind of merger with another ICB being considered? What's in the best interests of patients here? Will we get a say in that? And is there going to be any say in some newly structured setup for the patient voice? It's already been diminished in the context of the current ICB arrangements. The involvement of patients is pretty marginal as it is, and you can imagine it's going to be less marginal, less make an awful lot of noise about it in any restructuring. And I think the other broader issue that I think people will be asking that do understand a bit more about the present system is clearly this is about efficiencies. These changes about efficiencies. We want to know what additional responsibilities are going to be put on local authorities, which are pressed to deliver partnership with the NHS as a result of these changes. So these are questions, and I don't know where we're going to get any answers from or any involvement in the process. It's not clear at all.
No, I think that's right. And I think your assessments.
Yeah, I just thought it might be useful to come back on a few of those points, but conscious of as well, potentially, Chair. I mean, public involvement is obviously the PPG, and we did say that we would come back when we were able to talk a bit more about what resident and patient involvement will look like in the future, but we're very much not at that stage yet in designing the organisation to be able to talk meaningfully with people. It's just not a good time to talk to people about those kind of things because there's so much uncertainty to do. So on one level, there's always a bit of a challenge in this. There are people who are very engaged in the health system and health advocacy, do understand these things. I'd say the majority of my career, it's very difficult to explain what CCGs or PCTs or ICBs do to most patients and residents. So I understand that it's confusing for people to see some of these changes mooted. As you know, there's broadly speaking 50% reduction in the running costs that the ICBs are being asked to make, and some people just it was closing when it was, NHS England was being pulled into DHSC. So it is complex to manage the messaging, and our comms team will be going to work on that more now that there's more certainty coming. We've mentioned neighbourhoods a few times. I think the opportunity for us working together around neighbourhoods and talking to residents about that is much more tangible, much more in our control, and much more meaningful for most residents to talk to them about how those services are developing. We've got a big workshop next week, which resident reps and VCS reps and all of the sort of sectors working on services in Haringey will be at as the start of a sort of bigger conversation in the next phase about development of neighbourhoods. And my colleagues who are coordinating the North Central London programme on neighbourhoods of the ICB are going to be forming a community advisory panel, support resident voice into the work at the North Central London level, starting in August. So I think that's really positive to strengthen, as you say, Sharon, that resident voice into some of the North Central London ICB work, which there is lots, but it doesn't always feel that visible from a borough level. So hopefully we'll have those two happening in sync, and it will feel and seem more visible.
Tim, and thanks for bringing us around to the things that we can affect and impact on and make some change with. I think that's really helpful. I'm going to move us on to the next item, but noting that it's incumbent on some of us in the room here just to be sending back that message upward, because I do think there's a thread that comes that's national, and then there's a London thread to this, I think. So we will keep plugging away and take away the conversation to the political rep leader of Haringey at ICB and discuss this with her and feedback on the things that have been said today. Thank you all. I think in being open and honest with each other, please try to progress the things that we can together. Thank you. So moving on to item 9, which is the Haringey Carer Strategy. I'm really pleased that this is coming today. I feel like it's a really important part of how we address well-being of a really important part of our community in Haringey. This is also about our own improvement journey following on from CQC inspection. But I might add, I think it's much bigger than that. It's about our thinking as a whole system around carers and understanding their priorities. So I'm really pleased that we can hear from you, Jo, today.
Thank you, Councillor. Can I just check, should we get the slides up? Would you like me to put the slides up?
I can do it from my side.
Thank you. Everybody be able to see them there. I know everyone in class has them in their pack, yeah? Thank you, Sujesh.
Could I just add a little bit to what I've just said about context, Jo, before you start? Do you really feel that this is about everything we can do as a local authority? It's also about everything we can do with all our partners in health and in the community sector as well. I know many of you have engaged in this process in different ways. And for those who haven't, there's plenty of opportunity going forward. I do think it's a really important part. We all consider how we come together. A lot of the things that affect the experience of carers in Haringey are about what we can do as a local authority, and a hell of a lot is about the much broader system. And a lot of it's about how we all work together, as the recent conversation about blue badges at the PPG's meeting showed, for example. Jo, over to you.
Lovely, thank you, Councillor. So we, just to make sure we keep to time, we thought we'd have around 10 to 15 minutes on the slides and then questions. Is that okay?
Sounds very good.
Excellent. We thought we planned well there, Sujesh. So just to say that Sujesh Daraj is also here, our commissioning manager, and I just want to thank Sujesh, Alex and Rebecca from our commissioning team, because they've been really integral to the development of the strategy and bringing this today. So just to say a little bit how context. Data just gives us a real sense of the size and scale of the carers that we know of in the borough. It may well be the data that you have here actually doesn't reflect the totality of the carers that we have, but you can see it is absolutely substantial and it's a growing issue in the country and here in Haringey as well. And hence something that is an absolute top priority for adult social care and for the wider council. But it's almost part of the engine room of adult social care, the work with carers. And I think the bit of data, without reading out everything on the slide, is particularly important to me as an incoming director of social care, is that CQC did highlight for us that there were many areas of improvement being made in this critical area of our business. And these, the slides that we have today really reflect the work we've done over the last 18 months. And I think that's important to acknowledge, that the work did not happen or start to happen on CQC. It had been well underway beforehand. So I think just a little bit of a timeline as to the work that we've done to give you that sense of the journey. So it started in a robust way, I would say. We put the whole service behind it in October 2024, and we acknowledged that we needed a launch and refresh of the carer strategy then, and started doing work with those groups, the groups that represent carers, the carers themselves, voluntary and community sector partners back in 24. We published a survey, sent that out to carers in November. Say a little bit more about that in a couple of minutes. And did further engagement between December and April 25, further populate the priorities for the carer strategy. So the information from the survey and more direct face-to-face engagement. And then in May 25, and I was very privileged to be a part of these workshops because I'd started in post then, we meticulously planned, in my opinion, the workshops with carers that we held in the localities, in our lovely libraries, one day service in Wingfield, one online on an evening for carers that couldn't make day activities. And the outcomes of those workshops are why we're here today in part. They've helped us further populate the priorities within the strategy. And it was important that we did those workshops, colleagues, because we had a set of priorities, but I felt that we needed to check that they were the right ones, because things do change and shift, as we've discussed earlier. So it was quite important to go back out there. So this is just a bit more detail about the journey so far. So we've involved around 4,000 carers in our co-production journey that we've described above. Talked about the localities earlier. Really important that we'd establish the commissioning co-production board. So we've got a group of well settled in now, well-established group that work with Alex in commissioning and others, and they provide not the actual co-production activity itself. They're almost our critical friends and our advisors on co-production, and help us steer the work that we do with different groups around different pieces of work. So I've talked a little bit about the workshops that we've done, but there's a lot of work happened in and around those workshops way before I came, and working with Vida and other people that are represented on the call today. So we did walk-in sessions in libraries, talked about rights days, attending reference groups, doing a lot of work with the LD Carers Forum, critical part of our work with carers, and ongoing feedback from our social workers and from our commissioners, from all of our staff in working coffee mornings and Dementia Carers Cafe, and reaching out to some of those communities with whom we've not been as proactive as we would have liked to have been in the past. And we've mentioned 3 groups there. And in fact, Sujesh was critical to that work that we did with the Turkish and Kurdish communities, Somali Community Network, and the African and Caribbean Network. And I think we just kept testing and retesting some of the assumptions that we've made working with carers, some of the priorities that we'd identified, checking that they still resonated, and what the more subtle and detailed issues were for some of those communities that maybe are not always trusting of statutory services. And then this is just a little bit about the outcomes from the survey work. So we received 274 surveys back. For those of you that have been involved in surveys in the past, there's no one more cynical about surveys than me, but I think it provided us with a really good baseline starting point. And we've got the details to all the residents that we think going forward we'll go back to those same carers. See whether feel the progress that we need to make. So it's one key bit of information, but I think not as vital in many ways as the ongoing work that we do face to face with carers in workshops and in other work that we do. I think the statistic there that's really interesting for me is that 49% of those responded had been carers for 10 years or more. So some of the carers that we're working with have been carers for a substantial part of their life. And a lot of the carers here in Haringey, I think Vida may come in later and say a bit more, are older carers. And they are a cohort of carers within the group of carers that have specific needs, specific issues, and for whom we need to pay particular attention to, because as they become older, as we all become older, their needs change and their caring abilities change. So that was particularly important to know. And the 50 hours per week or more, the 53% of our carers captured as being their commitment to their caring responsibilities is significant and important also to know. Then my last slide before I hand over to Sujesh is really just what did that the survey say. And I think the data was really quite telling as to how engaged they felt that we as a service and the wider council were in terms of addressing their needs, hearing their voice and giving them choice and control. Many, 68%, reported poor, very poor or fair wellbeing, so that they didn't feel that their wellbeing was a priority for the services and support, not just the council, for services support in and around them. And though 26% of respondents said good or excellent, it's a relatively small group fed back. So we've just got to, take that on the chin, really, that this isn't a massive group of carers that came back to us. Communication and the provision of information is a consistent theme, not just for carers, actually for anyone utilising social care, access and support from social care and the wider council. And it's clear that it's an area that we need to put significant resource and capacity into addressing, and communication in a variety of formats. Many people still say and will always say that they like the written word, they like something they can put in their purse, on their fridge, that gives them just easy access to who is it that I need to speak to? Can I have a number with a human being behind it? Can I have it in my bag or at home on the fridge rather than the internet? Also important. And in fact, what came up there was that we needed to revisit our website and make information that's on our website more accessible as well. Respite was a big issue, and access to respite. And it's always a difficult issue, respite, wherever I've worked, because there are many different interpretations as to what it means. For me, it links in with the wellbeing piece. It might mean a short break. For you, it might mean a short break with the person you care for. It might be on your own or with your family. It might be access to yoga, to holistic therapies. It could be sport. It could be many, many different things. So it needs unpicking. It's really nuanced. But either way, 53% said they'd never had access to respite, whatever that meant for them. And many said that support groups and counselling and peer support would be a huge help. 68% said they weren't aware of any concessions that were available to them. And given the amount of concessions that are available in the borough, and there are many, we can really grab that. That's a bit of low-hanging fruit, something we can address at pace. And 48% of carers said they didn't have access to training. And I think, as we all know, around moving and handling, managing frailty, also managing complex autism and behaviours, all of those pieces change and shift all the time. So giving carers access to that training is really important. Largely, carers said they were dissatisfied with the basic services, health and financial support that provided to them. And accessibility and financial assistance were real areas that we needed to address by way of improvement. So just now, I'm going to hand over to Sujesh to do the next 3 slides.
Hi, everybody. My name is Sujesh Sundaraj. I'm a commissioning manager in Haringey Council, and I was working on the carer strategy. Thanks for that, Joe. but given the broad range of areas that we picked up as part of the initial discussions with carers and our partners, so we decided to arrange another round of workshops, as you mentioned. There were a total of 4 workshops, 3 in person, 1 virtual. As you mentioned, there's also weekend sessions. So attendees were included local carers, partners from health, social care, our care services providers, and the VCS organizations. It was really insightful and encouraging to meet so many new carers, especially in the workshops, to hear their stories. I think it was equally confronting to learn how much more we need to do to support our carers in the community. So in these sessions, obviously, we worked with carers to review and co-produce the areas of improvement, to prioritize based on what would make difference to their lives and the person they care for. And this was, on the premise that it'll build a strong foundation to build on with trust and collaboration moving forward. As you can see, there's some pictures over there from a session at Wingfield. The next slide is just want to touch on the vision and mission. We have kept the vision mission the same from the previous strategy because we thought it was still appropriate, and what we're doing now is an extension, is a lot more about extension of the previous work that we've already carried out. But the vision being all carers of all ages are recognized, respected and supported. And our mission is to ensure that carers in Haringey feel valued and respected as an integral part of our community, have access to high quality information, advice and resources tailored to their needs, receive timely, effective and compassionate support, and support them to maintain their physical, mental and emotional well-being, and so that carers are empowered to balance their caring responsibilities with their personal goals. So I just want to go into the key priorities. So further to our engagement and co-production sessions with carers, we identified 3 key priorities and 6 action plan themes, with each theme having areas of improvement under each theme. So these areas of improvement will direct our work over the next 3 years. The 3 key priorities that we identified were improving access to timely, clear and accessible information and support. Second one being strengthening carers' rights, well-being and resilience. And the third one being creating inclusive, culturally responsive services that reflect the diversity of Haringey communities. I just want to stress some focus on the third point. I think that last point particularly shown out when we had the workshop sessions and we met with carers, and how we recognize as a group how people have different needs and they need different flexible services offered to tailor those needs. And carers did strongly feel that sometimes councils can be quite policy driven, and sometimes that can restrict the flexibility and take away the focus from the person being at the center of the decisions we make. So that's just something for us to take back, and we want to make sure that's embedded in the actions that we take moving forward. So we identified 3 action plan themes, as you can see there, them being getting the basics right, information and communication, health and well-being, respite and breaks, financial resilience and employment, and last but not least being training. Getting the basics right. I'm not going to go into too much detail because I'm mindful of the time as well, but just want to recognize that carers just did talk about them wanting to make sure that they understood what their rights were as carers, making sure the council was doing more to identify and raise awareness around who a carer is and what their rights are, especially amongst professionals we work with on a daily basis. Improving this accessibility assessments and reviews was a key thing. As a council, we want to continue to make sure making sure that people are getting reviewed and assessed on a timely basis. Staff are empathetic and understanding of the person's circumstances, and we have a clear line of communication at all times so that we can support them adequately, no matter where in the borough they live. So care resilience and emergency planning, carers did very honestly, earnestly speak with us around how they would feel so much more empowered to advocate for themselves if they fully understood what their entitlements and their rights were. And that's again aligns with us as a council having this information available on the website and other platforms, and making sure that's communicated consistently and clearly with carers and the partner agencies we work with. Housing repairs and adaptations, a huge focus on the previous strategy. We wanted to make sure we continue to have that on our upcoming strategy, especially with the changes that have recently taken place with housing coming into adult social care. We feel there's more there's room for more synergy and partnership working to make sure some of those gaps can be filled. Carers wanted us to treat housing as a core issue as part of carers assessments and support planning. The next one being information communication. Joe, do you want to take that?
Just apologies, just conscious of time. I wonder
Yes.
if you could just pick out one thing of each of the next slides.
I was going to do the next one, wasn't I, Sujesh?
Yeah, go for it.
One thing and then move.
We could do with a whole. We could do with 3 hours, couldn't we, Sujesh, to talk about?
Yeah, there's lots in there.
Yeah.
Time for questions.
That's fine. Thank you, Councillor. I think thanks, Sujesh. We've covered a lot of the ground on information and communication, but I think digital exclusion is a piece we haven't covered off. It's back to how we support people that will not use the internet ever, despite the fact that we might provide them with laptops even. They want to come together with human beings. But for those that might be able to be supported in accessing IT, then I think we need to be offering that support by way of training and looking at the community organisations that would help us in that regard. And then on Health and Wellbeing Council, I'll just jog through these last ones. I've said a little bit about health and wellbeing of carers, but I think there is a real need to link in with our NHS colleagues and look more widely about how we support carers in localities and neighbourhoods going forward. Get into our carers as early as we can before there are bigger issues that are more difficult for them and more costly for us, speaking bluntly. If you don't mind, Sujesh, I think I'll just take the last few slides, just because I think we're quite short of time. Thank you, Sujesh. Respite and breaks, I've already said a little bit about. I don't think it needs a lot more explanation, but what I think we do need to do is promote what we've already got. And once again, reach out to our voluntary and community sector partners and NHS partners and say collectively what is the offer for carers, so that people can get to that information in one place and it's not scattered across various different places. And then financial resilience and employment. This is another critical piece. Our carers said to us that they would want us as a council to link in with employers. They feel that they face a lot of discrimination in the workplace where there isn't tolerance of them being a carer and of the flexibility adaptations that they might require to be able to be proactively involved in the workplace, earn some money, but also fulfil their caring roles. And many carers, as we all know, are not aware of what they're available to access by way of benefits. And there are often it's quite difficult getting support in that space because Citizens Advice Bureau and other organisations, the demand for their services is huge. So we need to think that how we can sweat what we've already got by way of getting them that support, but also maybe do more drop-in sessions in localities so that people can get to that information more effectively. And then training, I've said a little bit about that already, but I think we'd really love to move towards an integrated training model where we had experts by experience, that's the carers themselves, co-designing and co-delivering training with our social care, NHS and housing colleagues and our voluntary and community sector partners, so that we really feel that we're part of a team and not maybe working in silos in the way that it often feels like for our carers themselves. And then the last slide, councillor and colleagues, is really we're working towards approval at Cabinet in autumn 25. We think that will most likely be October now. The strategy is drafted, but needs some more work so that it's accessible for different groups of people and for partners as well. And I won't go and say a lot about the other actions that are on here because I think they will inspire some questions going forward in the meeting. But certainly, I think a workshop with health is something that carers in each workshop said that they would like to happen going forward. So we did have health colleagues present, but I think it was quite limited. And many of the carers had lots of questions and things that they'd like to discuss with GPs, staff working in hospitals, that I think we could collectively do a great deal more work.
Thanks, Jo, and thanks for the suggestion. You're all right. I mean, we could spend a day and really go through and delve into a lot of what are really important experiences that our carers have. I have to be honest. I mean, there are a really big system challenge here as well. For me, there isn't. I came across a really tragic case that really distressed me. There was a resident who was caring for her husband who had dementia, and he'd had a diagnosis for 3 years. And she lived in Crouch End, and she didn't know that the Haynes Dementia Hub existed. And sadly, what had happened is all her treatment had happened. They'd been seen outside of the borough in a hospital outside of North Central London, in fact. And so there just hadn't been that link and that connection. And so obviously by the time they came to me, they were in dire straits and hadn't had the kind of support that we knew we had available. So cases like that we come across all too frequently, really. So there are some challenges around how we make sure people are referred in the right routes and get the help as soon as they can. The work conversation feels really relevant. I've met with a relevant cabinet member on our approach to work and how we can enable people to have access to the kind of jobs that give them the flexibility they need, and how we can help navigate that relationship with employers. Finally, I just wanted to say how much I recently heard the story of some experts by experience writing a job description of a carer and then running training based on that for both health and council staff. So we know that if we centre people at the heart of those processes, we can do better than we already are. And look, I've given you all time to put your hands up. So now there are lots of hands up. And Nena was first.
Thank you for that. I really think an important session, often quite hidden and invisible voices who carry the weight of care quite considerably. And I think probably some real opportunities for us to use what's existing and better align that with our carers, and then to think about what additional. It made me feel a bit sad, I have to say, listening to that. And I have three key questions. One was, I think we surveyed 2,400, we got 274 responses, so that's less than 10%. And most of the carers described being carers for more than 10 years. So it feels like almost automatically we got the older carers. I wonder if you can talk about the profile of carers who've given responses and whether we think it's representative of all carers' needs. I really think about the younger carers and the school age carers and how do we hear their voices and how can we support them? So that was question one. The second question for me is, whatever our strategy, how do we know that we've succeeded? So whatever we put in place, how do we build in the opportunity to measure success, whether it is contact points or something, so that when we come back to this 2-3 years from now, we can say, and we've achieved what people told us they needed. So I think there's a real question in my head about building a central evaluation of success. And then the third question is, again, coming back to that, how do we use our existing assets? What's the appetite within our place to use things that are commonly being built as solutions? So the NHS app, how do we use the NHS app to say, carers, we want you to be able to be au fait with this, and through this you get a gateway into something else, because we start finding solutions to multiple problems from multiple different angles. Lastly, I'll leave you an offer. I need to check and see if this is an offer. My team will kill me. We do mandatory and statutory training all the time, including, lifting and handling. We don't always have all our courses saturated. How do we use that unused resource in NHS Trust for some of these key skills? And what's the contract we can set up around that?
We love an offer, Nena. So thank you. Who wants to pick up, Jo? Do you want to?
I'm hoping that Suresh will come in with the answer in relation to the data from the carer survey. We didn't include all the data because there are many slides, but we certainly can circulate them if that's helpful. And maybe Suresh can just give a few.
It's fair to say that the survey was only one part of the much wider engagement that happened to make sure we had that represented voice. So yeah, go on, Sujesh.
Yeah, no, thanks, Nana. In relation to your first question, you're right. Well, there was around 11% response rate, and you're right to point out that majority of the people who did respond was above the age of 50. So there was we've been doing an EQIA to look at that, but as part of that, because that was the initial phase as part of the survey process, and then we recognized that we needed more voices and perspectives, which is why we tried to make sure we went out and did the workshops and tried to reach different faith groups and different community groups as well. I don't think it's a perfect science, but we've done as much as we could to maximize that number of perspectives and views to try to get the final product so far. But it's a work in progress.
I'll come in if I can. There's also a piece of work happening as part of our transitions programme around the young carers piece as well that I think will evolve and add more as we go through, and that's sort of a collaboration across adults and children.
Thanks, Sarah. And I was going to add, we've also been experimenting a bit with Mobilise, haven't we, which is a tool that allows us to do more digital consultations for those who do want that, and having an offer, you know, people especially who are in full or part-time work, and just expanding what we have. So I think we'll learn a lot as we haven't, it's not, is it quite a year? It might not be quite a year that we've been.
Yeah, it's been just over a year, and I think the aim was to be able to reach the different types of cohorts of people, younger adult carers, working age carers, and people carers from other communities. So we have seen some impact. We'd like to sort of work on that and increase the numbers.
Thank you. Jo, do you want to come in on how we know what success we've succeeded? Feels like the conversation about KPIs, isn't it?
Yeah, absolutely. I think there's a few things there, and I think three things I would say. We've said to the group of carers that we met face to face, so just over 100 of them face to face, but of course we have contact with many others, that we will come back each year and have the same workshops to set the old model, very successful model of we said, we did. So they can give us a sense of, are there tangible improvements that they are feeling on the ground? We have many networks that exist already that we will utilise to and evaluate the success of implementation of the carer strategy. The Joint Partnership Board, as Sharon knows, and it's 8 reference groups. There's the LD Carers Forum that we meet with regularly as well, and Vida's on the call. So that's a face-to-face piece, that's a qualitative piece. I think quantitatively, yes, we absolutely should commission, if that's the right word, an evaluation of the carer strategy implementation. I think we should do that every year, and that we should share that with our stakeholders and our residents as well, just for transparency. But to your critical point, we do need some KPIs. Some of the KPIs are delivering our statutory responsibilities, which carers are very critical of, rightly, waiting times, assessment reviews, etc. Some of them, the carers would want to co-produce with ourselves. With us themselves. I know they would. What would make a meaningful difference to them? So access respite would be one. Accessing health and wellbeing activities would be another. But the statutory pieces were the ones in many instances that were of most interest. Production of information and advice would be another. They're all set out actually in the slides, but each one needs a KPI attached to it.
And there's also, Jo, quite a lot that's already measured as part of the national benchmarking around the adult social care outcomes framework. There's quite a lot of KPIs within that relates to carers directly that we will use alongside.
Thank you. Thanks for that. And I'd just suggest that we pick up the Nena's kind offer and we have a little bit of a think, and we could think about that maybe in a system way too, but thank you. So lots of questions and comments. Lynette next.
Yeah, thank you very much. My question would, maybe it's to Sujesh, and that is, were carers of those with mental illness considered? Because the responses speak a lot to people who are giving physical care, etc. And even the training requests where we're looking at things like safe lifting, etc. Doesn't sound like there were a lot of people either in the focus groups or elsewhere. Nana beat me to the young carers because they were a group that we worked with previously. So also didn't get a sense of young people speaking around their caring responsibilities. And I just want to end with, there was a lot of talk there about health and well-being. And we would, in order to kind of support that, we would be very happy at Minding Haringey to offer carers specifically our half-day mental health training, which only looks at how do you look after your well-being. And we could definitely relate that to caring and particularly mental health, because obviously that's our area of expertise. And I know there was talk at the end there about cultural competency training. Unfortunately, I can't offer you that free, but just to let you know that we are carrying out training with the trust, and we're happy to share any evaluation that shows whether this relates to the cultural competency training that you might need. But Sujesh, I just wondered if you felt like there was anybody in there, because those who care for people with mental health are often unrecognised. A lot of them come here and don't find spaces for them. So just wondered if you felt that you had some people who care for people with serious mental illness in your workshops or other places.
Yeah, no. We did have some representation and some feedback from carers who looked after somebody with SMI. We also had colleagues from BEH who were invited and participated. But I like we've spoken about young age carers, it's been a challenge. We'd like to see more involvement. I don't think we're quite there yet, but I think we've started those conversations and linked with professionals, and we're trying to be present in all of those spaces, to improve the quality of feedback and work on the strategy moving forward. This is the strategy for now, but those conversations will evolve as a group becomes larger. Thank you.
Thanks very much. And Joe's put a few notes there in the chat. We're obviously all looking forward to the Roger Sylvester Centre opening. And I'm pinning that on a real opportunity. But my suggestion is you have an offline conversation with Lynette.
Yep.
Offers another offer. I think gratefully received. Thanks, Lynette. That's really really generous and really supportive and helpful of our work. And my suggestion is that we bring back, because the young carers work is sitting elsewhere, a very specific piece of work and project that deeply involves children's services. Katsa Brabazon's not here today, so she can't tell us a little bit more about that. But I suggest that we bring that back to a future meeting, because I think it's come up a few times and obviously there's interest, and it would be useful probably for you all to hear a little bit more about that. If that's okay. Thank you. I'm going to move us to Tim.
Hi, yeah, it was just so the NHS funded social prescribers, did they feature at any point during the research in terms of their effectiveness or awareness of those roles?
We had conversations about social prescribing and how they can be part of these solutions. However, I don't believe we had representation from that group.
But it was more whether there was awareness of that role.
Yes.
With the carers.
Yes.
Yeah, it was.
Yes.
Okay.
Yes. Absolutely. That was part of our discussions as well.
Okay. And did they talk about whether they're utilised at all, or? How it
I
relates
think,
then back to general practice and so on.
I think the recurring theme was a different kind of practices. Different GPs had very different practices, and not everybody seemed to have a consistent, a clear understanding of social prescribers and their sort of the scope within which they work. And I think that again comes down to the same conversation around having clear understanding of different roles and how different individuals and their roles can be supporting some of the work or actions that come out of the strategy.
I feel like that also feeds in. Sorry, Tim. I don't know if this is something you and I talked about. I don't think it is. I still think we have a significant challenge in the borough, which is just around how we understand a few different kinds of organisations and roles doing similar but different things, and how that it's still quite difficult, I think, to explain really clearly to people what the distinctions and differences are and how those things join up. I don't know if Health Watch colleagues would agree with me on that one. So I think that's a challenge, and that's a challenge for all of us in the borough, really, because we have these different roles, and there's good feeling, I think, to do that thing, but I don't think it's always really clear. I suspect sometimes we might duplicate, and other times actually we're absent in a space altogether. And I might add, duplication is not always wrong, because sometimes people need more than one sort of go before they actually engage in a certain type of intervention, or you can quite hear the message. It's complex. But that said, sure, we're using resources well. I think it's still quite unclear for people. Sharon, do you want to come in on that point? Or on a different one?
Different point, if you want to.
Okay, I'll carry on then. Okay. Selina, I've got next.
Hello everyone. I put in the chat, I'm Celine Douglas, I'm the new Chief Executive at Whittington Health, so lovely to be here today. And I'm really pleased we're talking about carers. I'm actually launching late today with the MAC team. And one of the things we were discussing this morning was how do we use the great practice that we've got in the integration of that team around their support for carers. And it was around some of the points that Nana mentioned earlier in terms of moving and handling and all the support that we give to those carers. How can we replicate or make that more of a standard offer as part of the neighbourhood offer? So we were talking, how can we get this involved in the sprint this morning? So this is great timing. I wanted to raise that here to say that. And then another thing that I think is really important, I wanted to pick up the cultural competency bit that another colleague said on the call earlier, just to make sure we've got the right skills to be able to be working with our carers as well, and the right training around things like unconscious bias. But particularly we found it in terms of the LGBTQ plus population, and we've recently done a piece of work around our cancer services called the Project, which is around how do we make sure that we are not making judgments around who's coming to the hospital and whether they're a carer or not a carer or things like that. And I think how we can share that as a system when we're all tight on resources, and how do we work together on that, I think would be really good about having to take that forward.
Thank you. Thanks very much. It's good to hear that the conversations are live and happening as we speak. Thank you. Lost my Vida, sorry. It's you next.
Oh, hi. Hello, everyone. The workshop was very good because we're able to reach out to some carers who have no idea that there's a reference group out there. And they were having a lot of, we have one who is looking after the husband and her daughter. And she was finding it very stressful, but because of the workshop, I was able to help her to get to allocate test. Can you hear me properly?
Yeah, we can hear you, Vida.
Oh, okay.
We're listening intently.
Yeah, okay. So and now she's got allocated social worker who is going to support her to make sure that things are in place for her. So we need to do more of the workshop. And also some of the elder carers, they are getting old themselves and they have health issues. And with this workshop, they were able to bring it out. So we need to, as I said, we need to do more of the workshop.
Thanks very much, Vida. And I should have introduced you. Vida is one of our reps from the Joint Partnership Board and has been really involved in the process. So I think really helpful to have you here and sharing your thoughts. I think more in person has been more time spent physically together has been heard and understood. Thank you. Lynette.
Yeah, sorry, just my last point, and that is just because I was at the workshop last week about the welfare reforms, and the amount of concern from carers in that meeting about what will happen if there is this major benefit change. So just what we can do around that. I know that we were talking in that workshop about what support we're going to give people if these reforms do go through, because I think there'll be a wider impact if people are affected by the cuts that the government's talking about as well. So I know it probably wasn't in the strategy, but I just think that is something to think of as we go forward.
Thanks, Lynette. It's a live conversation, as you can imagine, and we'll be coming back to you and other organisations in the borough. I was going to give this as an AOB, but since you brought the topic up, I'll just flag to everyone that the council, Disability Action Haringey, Mind in Haringey, and the Citizens Advice Bureau in Haringey have today signed a letter to the Minister, Liz Kendall, expressing our concerns and sharing some of the data. That it isn't quite out. I was looking, I'd share the link if it was out. It's not quite out in the public domain, but it will be in the next few hours. And I would actually recommend that to you all because there is some really useful data on impact. I've done a lot of work within the council, and I think Lynette will be coming back to work with you in the community around what we can do to support people, information and advice, etc. A key part of that, but there'll be a hell of a lot more. Absolutely, once we know exactly what's going to happen. And the last question I'm going to take is from I had you, Sharon, and then
Yes.
Apologies.
Okay, can I say first, I'm really pleased to see this here, and thanks to Joe and Suresh, and also all the carers that participated in this exercise. As we all know, carers' time is very, very valuable, and it's actually very hard, because who they are to engage with carers. So I'm delighted that we've developed this strategy. But I've been around these issues for a very long time, and I've seen concerns raised and promises made about what is going to be done to alleviate the situation of carers. And like you, Lydia, I've come across some appalling cases, people that have struggled for years caring for them, often themselves living in absolute squalor, just trying to cope with impossible situations. And it's, and I'm glad that we've had this negative CQC report and we've decided to do something about it. But hopefully we started to win some trust from some of the carers and some belief that some of this strategy will be implemented. However, I've also seen promises not kept in the past. And I'd like to go back to Nene's point about evaluation. I think what would be sensible to do would be to ask somebody independent to come back after a year and maybe the year after to look seriously about whether or not progress has been made and the promises have been kept. And I think that will go a long way towards keeping the carers involved in this process. We know that there are issues. It's not all going to be resolved within a year, and it needs to be a multi-agency response. But I think if there could be some independent evaluation of progress, at least after a year, but not and something beyond that, I think it would go a great deal towards actually making this happen and driving this forward.
Understood. Thanks, Sharon. I think your point's well made. I suppose I'd emphasise that we actually started work on this quite a long time before. See, I think that's not the only thing driving it. But of course, it does help focus the mind, and also help focus the mind of all organisation and the system as well, I'd say. And I think bringing it here is really important as well, because I think there's quite a lot there that informs carers' experience, which is about the council. Quite a lot that also goes beyond that, and that's, I think, I've heard some quite engaging quite strongly with how they can support us. I think that's useful. But we'll absolutely take that away and think we're still in the working phase of KPIs, I think. And also, fair to say, isn't it, Jo? Is there anything else you want to say on that?
No, I respect what Sharon said, and I think Vida, I said to Vida, the proof's in the pudding, and she said actually the proof's not in the pudding, it's in the eating. So we've got a lot more work to do, but I think an independent evaluation is excellent. I think it's really, really helpful idea. Thank you, Sharon.
Mike, you're the last one on this.
Well, the benefit of coming last is that everyone has said what I've asked. So, but I think there's maybe a couple of variations that I agree. The KPIs, measurable outcomes, and timelines, I think obviously are. But I think what's really, I mean, the Haringey deal essentially was inspired hugely by the work of Adults and Health, actually. And I think, there's been a lot of work in terms of adults health and social care, where it's led in that kind of co-production area. And so it's really important. But I do think, when I saw getting the basics right, there were sort of two aspects of this. One was, yes, it's really important to always be looking at and never be complacent, and always go back to making sure you're getting the basics right. But also, obviously, it was a flag, as Sharon sort of pointed out, that there are many carers struggling with fundamental service access and recognition. And that's kind of worrying, right, as well. So it shows that even with the amount of work that has been done in adults in terms of co-production, there are still a lot of voices that aren't being heard. And I think there's an opportunity here, maybe with the Carers Strategy Working Group, to look at how there can be some innovations in engagement. And look, there was talk about young voices, for instance. And one of the issues here is, there's lots of locality work, but still, are we going into the localities and inviting people? We went to the carers coffee mornings, obviously, which is, their space, as it were. But just it's very like, basically you can end up talking to people who are self-nominating to talk, right? And that's, so in a sense, you're still out there, you're still engaging, but you're engaging with the people that are nominating themselves too. So I think it's just, if there's room to look at innovations potentially elsewhere in the way that engagement can be enhanced, I think that would be.
Yeah, I think you're right. And I made reference to Mobilise earlier. That's an example of us trying to think differently and engage people. Although many people don't engage, there are a lot of people who do. I think it's very commonplace. Sorry. Problem with noise here. So I think you're right. I think that's a useful challenge and a good one to end on. And so we'll take that away. We'll take away the input. I think we'll also go away if colleagues don't mind. Just think. I'm having some trouble here with windows and blinds and noise. And we just take away also how we continue to engage everyone and all health colleagues and everyone in the system in how we change and affect change for carers, basically, if that's okay. Now, colleagues, I've just been alerted to the fact that some time ago we did agree these meetings would go until 4:30, but it appears that in the calendar today it's only been put in until 4 o'clock. So I think that's a little bit free.
So it should be 2 hours in this instance. I think we lost an half hour when the venue changed, but the original invite was 2 to 4.
Right. Okay. All right. So apologies. Is all I can say. We're a little bit out of sync and in the right timings. Okay. That's okay. Understood. So I'm going to move us on to the next item, and it's the Haringey alcohol strategy. Will, do you want to?
Yes. Hi, everyone. I'm Will. I'm Director of Public Health, and it's other colleagues who are going to talk about the alcohol strategy. But this really fits in with our healthy place theme of the health and wellbeing strategy. So this isn't just about alcohol services. It's about how Haringey is a place that supports prevention and support for people with alcohol issues, but also around issues around advertising and accessibility of alcohol as well. And we're also doing sort of basic policies around tobacco and healthy weight and toilets and climate and various other things that fit in with this theme. Marlene in my team is going to do a very concise presentation on the strategy, but I also wanted to ask, I've got Danny and I think, did I see Sonia as well on the call? I don't know if we've still got Sonia, who are from our provider, from our main provider of alcohol services in the borough. So Danny and then Sonia, do you want to introduce yourself and then we'll go into Marlene? Danny,
yeah.
do you want to go first?
Oh, yeah. I'm Danny Hickman. I'm the area manager for Way Through, and I cover services, including the Haggard service, which is the specific alcohol service in Haringey.
And I'm Sonia. I'm the assistant director for Way Through. I cover all services across London, but I'm quite heavily involved in Haringey at the moment. Nice to meet you all.
Thanks very much for being here.
Marlene, over to you, and introduce yourself as well.
Hi, I'm Marlene Diagler in Public Health as the Health in All Policy Strategic Lead, and I will be very efficient today with my presentation because I am conscious that of the time. Sorry, I'm just trying to. My bottom bar has disappeared. That's great. Let me see if I can share it another way as a full screen. Apologies. If you can see it this way, because it's not allowing me to. Yeah, you can see it. Great. Sorry. So this is about the alcohol strategy and action plan, which would run from 2025 to 2029. And why focus on alcohol? I'll just pick out a few points. That there were 23 alcohol specific deaths in 2023, 62 alcohol related deaths in 2023. That would include things like cancers, pancreatitis, heart disease, that's alcohol related, etc. There was 1,148 potential years of life lost due to alcohol related conditions in men and 379 in women. We do have a lot of hospital admissions due to alcohol related harms, and we have 1,107 licensed premises that can sell alcohol in the borough. That's about 37.4 premises per square kilometre. That's increased from 660 in 2015-16. It's the 10th highest amount of premises in England and also in London. And the cost of alcohol harm in Haringey is estimated to be 143.3 million a year, and that equates to 542 persons. We carried out a CLARE assessment, and a CLARE assessment is looking at challenging services, leadership, and also results. And it comes into a spidergram answering all the questions, and you can see on the right, on the left, that we have a lot of strengths in terms of delivery of services and also achieving outcomes. But on the right hand side, when it comes to partnership, communication, planning, commissioning and vision and governance, that's where our weaknesses showed up. And so you'll see as I go through this document how we've addressed it. We did a number of engagement, including focus group was held at Insight platform with people with lived experience to discuss what they think about the strategy, and also when we was pulling together the health and wellbeing strategy, we met a lot of residents and professionals and volunteers and got their views. So we didn't go back out to them. We incorporated it into this document as well, and we spoke to partners across the council, NHS and VCS, about the strategy, looking at these key issues. And I think I'll just home in on the last one, and it's about the language, not to be condescending, but understandable. So the risk groups that through and this has come through all the research. We've also got JSNA, which I'll talk about a little bit later, that there is this deprivation alcohol harm paradox, and that means is that more alcohol related health problems are found amongst people who are of a low socioeconomic status compared to the higher socioeconomic status. However, there is higher alcohol dependency in those of the higher economic status. So you'll find more hospital admissions with those of lower economic status, and they think some of the issues could be to do with how people consume alcohol, other issues to do with being in a multi-deprived and area, and also the conditions of cancer and liver disease, and also access to healthcare. Included in that is people who are homeless. 38% of eviction incidents is related to alcohol and drug use, and also the obviously women who are experiencing gender-based violence are 3 times more likely. It's due to substance misuse than the women who are not affected by gender-based violence. So this is the current partnership, and it will expand as this work develops. So it's not the finished article, but certainly we've got the vulnerable populations representatives there. We've got trading standards licensing, NHS, way through, and Insight platform, and I'm sure there's many more, community safety to be added that as alongside public health. So how did we get here? It was through research, data gathering, talking to people with lived experience, talking to residents, building up those partnerships. We had our first partnership meeting, which was more of a round table to introduce the work. That was last year, 2024. And during the year, we have been building up this work. And in March 2025, we had the first partnership meeting. We've gone through several drafts, and that the document is in the pack. We presented it to our lead member, which is Councillor Dadsneves, and also today. So if there's any comments that you would like added, or any points that you would like further information on before we publish. I'll quickly just touch on the action plan because I am conscious of time, and just to say that all the ambitions that we came up with was a joint response from everybody. It went out to the people with lived experience as well to make sure that they were in agreement and tweaks were made. And just to touch on some of the key points here, in terms of alcohol, the work that we need to deliver in treatment and support needs to be a systematic whole family approach, and we need to tackle underage sales of alcohol. In Live Well and Age Well, the joint ambition for individuals and communities to make responsible choices around alcohol and support those in need. And just again, just focusing on the treatment and support and the prevention is to ensure that we promote healthy behaviours and well-being amongst alcohol within the borough, but also within workplaces. So there's work to be done by all. And also within the treatment is to ensure alcohol treatment is available and right for everyone. And it's a holistic approach and supports people facing multiple disadvantages. In Healthy Place, we do have some work that goes on around the Responsible Retailer Scheme. It's a voluntary scheme that that retailers sign up to who sell alcohol to say that they will adhere to not having underage sales and a number of issues that they will make sure, for instance, that their cheap ciders and high volume ciders won't be as soon as you go through the front door. And there's other criteria to be part of the Responsible Retailer Scheme. We do have to limit antisocial behaviour, we have public space protection orders. And it links to wider work that's already going on across the council and across other organisations. And to address the spidergram, the partnership will meet twice a year and update the action plan. We intend to report annually to the Health and Wellbeing Board, as well as the other boards around Start Well, Live Well and Age Well. And we'll future focus is to improve looking at advertising and licensing and embedded in other policies. And as I said, we've got an alcohol joint strategic needs assessment, which some of this information has come from, and that will be published soon as well. Thank you.
Thanks, Marlene, and thanks for rushing through. I might suggest that maybe through Cody, that when we do publish the Joint Strategic Needs Assessment, that we circulate it to Health and Wellbeing Board. So I think that would be a good idea, especially since some people have had to leave us now. Are there any comments, observations or questions? Sharon?
I'm just interested, doesn't seem to be much in this about drinking in old age, older people. Do we have any data about that among both men and women? It'd be helpful to have data around some of the issues. I don't have any evidence, but my impression is that there is an issue amongst older people, both men and women. And as you say, the link between that and other illnesses is a serious victim. Most older people are like to have other conditions. So I don't know.
Yeah, I was going to suggest bringing perhaps Danny and Sonia in to talk a bit about how what the services see and how they support older people. I think in the strategy we haven't made a specific distinction, but I think it might come out in the JSNA because it tends to be an issue. It can be an issue in older people, but also as people are getting into that kind of middle age as well, maybe excluded from the labour market. So there is quite complex and nuances, but I think we do need to have a specific focus on older people.
I was just going to say, I do remember at the end of the pandemic, we had a session with there's a lot of our work in Haringey. Danny's probably going to come in and say this, is lived experience led, and was a really good conversation. I remember at the pavilion in Chapman's Green around people drinking at home. And that kind of brought, and that the minute you talked about that, that's where I went as well, is the access at home and cheaper alcohols, certain types of stronger alcohols. But anyway, let's bring Danny in.
Yeah.
Apologies.
Yeah, I can go first. I mean, I don't have specific data around the percentage of sort of middle-aged to older age drinkers, but the patterns that we do kind of identify is, as you said, the kind of social isolation, drinking at home, family isolation as well. And a lot of it revolves around long-term conditions as well. Individuals have been drinking for, excessively for long periods of time. Will have sort of long-term conditions, and we've identified those that are coming from the hospital as well. So we've currently got a hospital kind of care team, as we call it, that works quite closely with the hospital liaison team, and they're sort of identifying alcohol-dependent clients who are admitted onto the wards. So we have a specific worker that would engage with them on the wards, and that obviously would participate in giving education around alcohol, also training up staff in terms of screening individuals, but also providing contributions towards discharge plans. So one of the things that we are doing is liaising with the staff in the hospital, but also ensuring there's a smooth transition from hospital into the community, and then providing that additional support in the community for older age groups.
Thank you. So, and I think Marlene just shared in the chat, Sharon, that the joint strategic needs assessment, which my experience of those how often is that they have much more detailed data. So that it'll have a lot of data about what we do see and what we don't. You know, Sonia, did you want to come in?
I think Danny's covered everything, but I was just going to add that if you'd like data, we can produce it if you just, kind of outline the specifics of what you require and who to send it on to.
I think that's definitely an ask, but I think it'd be good to see what you'd look at in the joint strategic needs assessment anyway around age and prevalence. Tim, did you have a question or a comment?
Just a sort of brief addition to that. There's a data and insights group, the Wills colleagues and public health leads, and trying to get ICB analytics colleagues increasingly close working with them, because I think we'll be able to use the London Data Service and other things that are coming through to improve our population health data to be able to feed into the JSNA much clearer, much more adaptable data sets to understand the health profile of the populations through that. But yeah, certainly just on an anecdotal point, and colleagues in sheltered housing teams, for example, they've identified a real increasing prevalence of alcohol as a challenge for their tenants over the years.
So let's take that away then also as a sort of point of exploration, and actually Sarah here, that it's perfect to look at, that interaction between health and housing.
It's really helpful because we've been picking up on some of these things as part of our discussions as a directorate, and bringing adults and housing together part of that purpose. And smoking is the other area, the prevalence of smoking in social and sheltered housing as well. So yeah, they're the interesting conversations where, thinking about our joint priorities as the new directorate, and these are some of the areas that are coming out very much so.
And you know what I think also might be useful? It might be useful because we do have some really good lived experience groups, and there's a lot of that leadership in our locally in services. I think it'd be really good to explore some of these topics. So we could take that away. I'm sure we're going to do that anyway, but just to explore and bring back some of that, what those groups tell us about what they also think are the right kinds of responses, and that will inform our services. No doubt you've all got that under control anyway. Lynette, did you want to come in?
Yeah, thank you very much for that presentation. My question was more about just the diversity of the borough means that there are actual cultural groups who, from our experience of working with lots of grassroots organisations, are more likely or have a high prevalence of drinking quite heavily. And I don't know if that came out in or how we're going to target them, either through language or just those cultural reasons why people drink alongside some of the other things that we heard there in the presentation. And just to say, Melanie, I think it is, isn't it, that we welcome a presentation in the Haringey Community Collaborative that we could organise, because I'm not sure how much of the voluntary and community sector know about this new alcohol strategy, but I definitely know that there are a lot of issues in managing people who turn up to groups and support who might be under the influence of alcohol, etc. So we really welcome you in our sessions, but just how we're going to approach this in a cultural way.
I agree.
I think it's a really helpful observation, Lynn, and I think actually we definitely do need to join up, because I sense these conversations back to our lived experience groups. There's lots of discussion and already lots of thoughts and ideas, and it's about joining those dots and making sure everyone's benefiting from those conversations. And it does connect open smoking to with gambling harm as well, and some of our other approaches. So heard and understood, Mike.
I will say that actually, just on that last point, I actually have there are issues within my family with drinking, so I actually do understand it, and I'd say that one of the real challenges on a sort of interpersonal level is it's an addiction, and you're dealing with resistance, denial, all of these kind of things. So it's not a simple thing of sort of going, look, there's a problem here and I want to solve it. Actually, a lot of people are saying there is no problem, right? So I think it's really important. This is having a focus. There was just one aspect of the actual data that I was really quite shocked. I'm sure I read, so 1,100 licensed premises, which is almost double it than since 2015, if that's correct. It sounds like a massive proliferation of access to alcohol in this borough in the last 10 years, if that is the case. So just really like just clarification on that, but also to licensing and planning. We've got the local plan is being developed at the moment, and I just wondered what kind of interventions can happen at that level where you're actually sort of essentially reducing the access, which I think is potentially quite an important lever.
I think that's really useful, and the local plan has been here, so it's a really good point you make about making that connection. Although what I understand is there's huge growth in drinking at home as well. So both of those things together. Marlene, you want to come in on that?
Yeah, that increased rapidly during lockdown, especially when, in order to survive, I think the then government allowed a number of organisations, retailers, and cafes to start selling alcohol. And also the rise of the dark kitchens and the dark supermarkets that sell alcohol as well. So those are the online supermarkets where they don't actually have a base. We still see a lot of applications coming through, because we get the applications from licensing as well. Where cafes are now selling alcohol where they didn't before. So that's been a huge increase, and that continues to grow every week.
Marlene, it's worth saying that Marlene, in her role in Health in All Policies, has been part of influencing the work of the local plan, but also does respond, don't you, to each and every one of those applications through your team.
Our team does, yes.
Yeah.
Yeah, so maybe that's something also to pick up, because we will have the local plan come back again, won't we?
I think the challenge is, and Mike, you alluded to this, but we have a drinking culture in this country. It's still acceptable. So there's those harms around kind of smoking that we've talked about. There's been a real clampdown on smoking, but alcohol is still part of the culture. It's widely available in the borough, and we are limited in that kind of how we change that narrative and in the availability. So they always talk, the big national thing that we're always pushing for. One is minimum pricing of alcohol, which they've done in Scotland. And the second one is for health and public health to actually be a criteria for a licensing application. And it's not at the moment. And that would be the real kind of game changer, because whatever we do in the local plan, whatever we do with our appeals, we are really, really kind of limited. And our residents are telling us we don't want this on our high streets, but because of the commercial reasons I talked about, we are quite limited, and that is how those businesses make money. Alcohol is that's why they spring up and want a license, because alcohol and even cigarettes, they're still making money, because it's one where people will just walk a short distance to get alcohol. Other things, they wait for their weekly shop, but for a local shop, alcohol is absolutely important to their survival. So really challenging, and I think that's why we wanted to bring this to Health and Wellbeing Board, to highlight how alcohol, a lot of it is hidden, but a lot of it is visible, and it is really causing a lot of harm in the borough still.
Thanks, Will. That's really useful, and some campaigning points for us as well in the borough to think about. Vida's got a hand up, and then I'm going to move us on because I'm really conscious of time.
Yeah, we are talking about alcohol. What about gambling? Because there's so many gambling around, and you could see that some of them are drunk.
Yeah, absolutely. Well, I feel like we could have a lengthy conversation on that one. Vida, we've got a whole gambling harm programme, but it is a really big issue. And in fact, I was somewhere yesterday in the borough, and I was quite shocked by and I'm surprised. I'm still shocked, because very little shocks me quite how rowdy it was. It's a really big issue, and we're campaigning quite a lot on it. So I'm happy for us to circulate a bit more information to the group on our gambling harms. I don't think we've got time now for a lengthy conversation.
I popped in the chat earlier the fact that actually we won an award for our work in terms of on gambling harms just last week, didn't we? So I put that in the chat, Vida.
So we have won an award, but we know that there's a lot more work to do on that front. But thank you for raising it, Vida. It's good. It's a useful reminder, and we might want to bring that back to Health and Wellbeing Board at some point in the future. But it is an absolute focus, and actually we feel very supported by residents on these issues. Actually, they all want us to tackle and do as much as we can, and I feel we are. And a little sort of, I've just had a conversation with another borough, and they're on their licensing and what they're going to try and do in that, and the hope that they might be able to press and be able to turn down more licenses. If they're successful, we'll be following suit, no doubt. Watch this space, but thank you. I'm going to move us on. I feel like we're going to come back maybe to alcohol strategy once we've had the JSNA and a bit more data, but let's try and get that circulated when it comes out to the group, and then think about what more we'd like to do with everyone here. Thanks to Marlene, Danny and Sonia, not least for tolerating not having a lot of time. Moving onwards, we've got the Better Care Fund. I'm going to just have a really short update. We've got Caroline online.
Yes, you have, Councillor. So, hello everybody. For those of you that don't know me, my name's Carolyn Humphrey, and I am the head of Service Improvement and Development and Social Care, and I'm part of the group along with Tim Miller, who sort of coordinates some of that work. So I'm very conscious of time. I'm also very conscious that we've been before with things, so I'm just going to whiz through to sort of go through these. So there's two parts of this presentation. We're sort of closed down 24-25, and also there's the approval on the submission on the 25-26 plan. As I say, we've been up for both of these previously, but it's about ratification. Some highlights in terms of this. Out of 24-25 outputs, we've had 4 indicators. Only one of these was met, but there's been steady progress in all areas, providing a greater foundation for this year. Improved data is helping us to identify areas to tackle and build, and there are planned joint working development activities to build on this. To confirm all funding for the last year was spent in accordance with the plan. There were some output exceptions, the result of increased unit costs, more complex needs identified in some areas, and failure to reprofile outputs with better actual data. This plan was set up sort of like 3 years ago. So that's sort of like the, so that's for the end of year sort of thing. So 25-26, just as a reminder, this is an extension on this year because the government wants to do a review of the Better Care Fund. So we're waiting for the plan going forward. The seal area. So this is really a 3-year extension. Just a reminder, we got some additional funding, about 400,000 for the DFG and an extra 3.93% minimum uplift on the minimum contribution, and just some realignment of funding that went in there. Now, these is sort of like, we've sent separately a more breakdown of some of the where the money is spent sort of thing, but these give you an overview of the areas. To confirm, as I said, this is the 3rd year of a plan. We have limited sort of like scope to move around between the areas that we've agreed. And what we're actually looking at now is actually looking at what we spent the money on and actually being focused on doing an evaluation. So we've got the grounding to go forward for the for when the next framework comes out and where the focus grew. And this was just to give the board an overview of the sort of areas where there's different elements of collaboration, joint working and oversight of the Better Care Fund, although I'm sure you probably getting used to seeing us coming to you an awful lot sort of thing. So in short, it was really just to give you that overview of the end of year, and also to lay the foundation for the work that's going on this year. The next update we're due to give is in August for the year 1 thing. So I'm very conscious I went through that very quickly. So but I'm very conscious been to you before and that you're overrunning. So
thanks, Caroline. Well, what I'm going to suggest is actually that obviously the thing that might concern people most is where we haven't quite performed or achieved where we'd like to. And I think it might be good to come back to the next meeting, and maybe we'll put, or our BCF gets put at the end every time. There are always so many really important things we want to talk about. Maybe we could have that at next meeting, if that's the right time in terms of data-wise, and we talk through where we feel we haven't quite performed, why that is, and what we're doing about it, and maybe talk a little bit either about the evaluation if you've already got it, or what the plans are for that evaluation. Because for me, it feels like the most important thing is that we're really prepared for this next phase.
Yeah.
And change by a government. My feeling was that from government, quite a lot of some of the passporting money that's going into health will go, if it goes to joint work, it might be through the BCF. So it feels really important that we're ready for that, and that we understand that we know what's good, we know what are our weaknesses and vulnerabilities, and we've got some ideas about what next if there is more money.
Yeah, I just was going to say exactly that. And I think we already know, and we see through the guidance coming through for this year, that direction into prevention and neighbourhoods. And I think we are expecting that to be the focus. And of course, what's coming, I think, any day now, Tim, is the formal 10-year plan, which I think will again lay the foundations for the direction around BCF. But we wait to receive that, and also what the funding envelope may be in relation to 1 10-year plan and 2 BCF more formally.
Thank you. So
and hopefully the breakdown was helpful, just by way of transparency. That did come as a supplementary pack.
So, and I'm really happy for anyone, because we don't really have time now, want to, if you've seen something in the pack that you'd like to raise, please do direct it. Email me, ideally copying Cody so she can keep track of me, and we'll make sure that we have responses on that. and those might be themes that we pick up when we speak about the BCF next. But apologies, we don't have time to do more. There are 3 more things that I want to do. One is to say I noted that Gordon wants to come in quickly. So you haven't spoken today, so absolutely.
Okay, thank you, Chair. Can you hear okay?
Absolutely.
Yeah, thanks. I just wanted to raise, and I'll be very quick, something that unfortunately does seem to keep slipping down the agenda, the need for a dementia strategy. There's a lot going on in the borough, some quite good work in different places. I follow it a lot through the dementia reference group and talking to people, particularly in the NHS side. But there is really no joining up of what's happening, and it affects a lot of people, not just those with current dementia around 2000, but everybody with mild cognitive impairment, which is probably several times that many. So could we please have a future agenda item and a report? I think Louise in the NHS was preparing something, in fact, wouldn't need a lot more work on how we get a dementia strategy together for the borough.
Absolutely. That was one of my 3 things, because I noted your comments in the chat earlier. So thanks, Gordon. Absolutely. It hasn't slipped off the agenda. It's just that we've got a long list of different things we want to cover, and as you see, not a lot of time. So it's still very much as a future item. We're definitely going to bring that back to you. And I know there's a lot of work taking place, as you suggest. I'd also like to suggest we bring back a piece of work on Black maternal health, because we haven't had that back for a while. And I'd also suggest we have a little bit more of a conversation at a future session on women's health. So those are 2 of my things. Now, my final thing is Sharon's last Health and Wellbeing Board. And I just really wanted to thank you on behalf of the Health and Wellbeing Board and residents in Haringey for all your work and input in your role at Health Watch Haringey. It's okay, don't fear everyone. Anyone who thinks Sharon's leaving us, she will be in the ether as part of Haringey Circle and driving that work forward. We wish you well. We thank you sincerely for all the challenge, the input, the thoughts, the formal and informal conversations. I personally do as the chair. You've always been robust and supportive. And actually, we wish Haringey Circle and all you lots of success with that venture. And we know we're going to see more of you through that work. Thank you very much.
Oh, really?
Yeah, the bag went up me.
Oh, it's going to be good on the bus, isn't it?
Yeah.
I think we might be best holding it like that.
Thank you very much. I've got a bag in.
Yeah.
Oh, thank you, Lydia.
Thank you, everyone. I'm going to call the meeting to a close.
Sure.
Thanks for your participation. And if you have some other things you feel should be on the agenda, we haven't talked about for